What is appendicitis? Appendicitis is a sudden and painful inflammation of the appendix that can become fatal if not treated in time. The appendix, a small, finger-shaped structure connected to the large intestine, may seem insignificant, but its inflammation can cause excruciating pain and potentially lead to rupture. For those over the age of 40, the severity of appendicitis is amplified, as diagnosis can be more challenging due to less obvious symptoms and coexisting health conditions. Therefore, understanding how appendicitis manifests itself and what risks it presents is vital. In people over the age of 40, the inflamed appendix can cause less common symptoms, such as generalized abdominal discomfort or mild nausea, which are often mistaken for less severe gastrointestinal problems. This delay in symptom perception can lead to serious complications, such as a rupture of the appendix, which releases dangerous bacteria into the abdominal cavity, causing a potentially lethal infection called peritonitis. The older the patient, the greater the risk that the condition will worsen before it can be treated. Enjoyed this content? Then don't miss out on the other videos on my channel. I'm sure you'll find something that catches your interest. And if you haven't subscribed yet, make sure to hit that subscribe button and turn on notifications. That way, you'll stay updated with all the new content and help the channel grow even more. I'm counting on you. Appendicitis is not just a medical emergency, it's a race against time. The risk of a rupture increases significantly within 48 to 72 hours of symptom onset. This makes quick recognition and seeking immediate medical care crucial. In older patients, the complication rate is higher due to the body's more attenuated inflammatory response and the presence of other medical conditions. Therefore, a deep understanding of the signs and a quick response can literally save lives. Why is it worrisome? Appendicitis in people over 40 isn't just a common tummy ache. It's a silent threat that can quickly progress to an emergency situation. With aging, the wall of the appendix becomes thinner, increasing the risk of rupture even before the most alarming symptoms manifest. In addition, other medical conditions, such as hypertension or diabetes, can further complicate clinical presentation and treatment, making the situation much more dangerous and complex. Older patients have a higher rate of complications, including generalized infection, due to the reduced immune response that occurs naturally with age. An infection that spreads after a rupture of the appendix can cause septicemia, a potentially fatal inflammatory response. The body may struggle to recover from emergency surgery and a generalized infection. Therefore, the severity of appendicitis in older patients requires a quick and effective approach, with an early diagnosis being crucial. Ignoring the symptoms or waiting to see if the pain goes away can have disastrous consequences. Time is of the essence. A delay in treatment can turn a treatable case into a life-threatening medical crisis. For those over 40, a proactive approach to unusual abdominal pain can be the difference between a full recovery and a tragic outcome. Understanding the seriousness of appendicitis at older ages is critical to avoiding these devastating complications. How to identify the symptoms? Identifying the symptoms of appendicitis in people over 40 can be like finding a needle in a haystack, especially when the symptoms are subtle or atypical. Often, the discomfort begins as a diffuse pain in the central abdominal area that gradually shifts to the right lower quadrant. However, in older adults, the pain may not be as localized or intense, which makes it difficult to identify accurately and can delay seeking medical help. In addition to pain, other signs may include moderate fever, nausea, vomiting, and loss of appetite. However, it's easy to confuse these symptoms with other common gastrointestinal conditions, such as gastritis or indigestion, especially in older adults, where these problems are more prevalent. The absence of acute pain does not mean that appendicitis is not a possibility. In some cases, especially at older ages, the appendix may rupture before the classic symptoms fully manifest. The complexity of diagnosis in older adults underlines the importance of a thorough and detailed medical evaluation at the first sign of abdominal discomfort. Imaging tests, such as ultrasound or CT scans, are often necessary to confirm the diagnosis, given the less typical presentation. Waiting for symptoms to become clearer can be a dangerous approach, reinforcing the need to act urgently at the first warning sign. Diagnosis and treatment process. The diagnosis of appendicitis after the age of 40 is a race against time, where every minute can determine the outcome. The process begins with a detailed medical history and a physical examination focused on the abdomen. Doctors look for signs of pain located in the right lower quadrant, but in older patients, this pain may be less pronounced. Therefore, imaging tests, such as ultrasounds and CT scans, become essential for an accurate diagnosis. Once appendicitis is confirmed, treatment usually involves surgical removal of the inflamed appendix, a procedure known as appendectomy. In older patients, surgery may be more complex due to potential comorbidities and potentially slower recovery. In some cases, especially when appendicitis is diagnosed before a rupture, minimally invasive laparoscopic surgery may be an option, reducing recovery time and associated risks. If the appendix has already ruptured, treatment becomes more complicated. Emergency surgery is required to clear the infection from the abdominal cavity, and the patient may need intravenous antibiotics for an extended period. For older individuals, recovery may be prolonged and should be carefully monitored to avoid complications such as abscesses or secondary infections. Every decision in the treatment process should be carefully considered to ensure the best possible outcome. Postoperative care recovery from an appendectomy in patients over the age of 40 requires special attention and meticulous care. After surgery, it is critical to monitor vital signs and watch for any signs of complications, such as persistent fever, severe abdominal pain, or signs of infection at the incision site. Recovery time can vary, but the main focus is on preventing complications and promoting proper healing. A bland diet is recommended initially, progressing to more solid foods as tolerated by the patient. In addition to feeding, early mobility is encouraged to reduce the risk of deep vein thrombosis, especially in older patients who may have less mobility. Light exercise and short walks are recommended to help with circulation and speed recovery. However, it is essential to avoid strenuous physical activity and lifting heavy objects for a few weeks to allow the abdominal muscles to heal completely. Following up with regular doctor visits is crucial to ensure that recovery is progressing as expected and to address any complications that may arise quickly. In older patients, the risk of postoperative infections is higher due to the weaker immune system. Therefore, close monitoring and open communication with healthcare professionals are essential for a complete and hassle-free recovery. Are you prepared to face a sudden pain that could change your life forever? Appendicitis after 40 can be more than just a simple emergency. It can be a ticking time bomb hidden in plain sight. Why does this tiny, forgotten organ hold so much power over our health, especially as we age? And how can knowing the signs make all the difference between a swift recovery and a dangerous complication? Stay with us as we uncover the hidden symptoms, the urgent need for quick diagnosis, and the crucial steps to take after surgery. Your health might depend on it.